very good question. But the important thing is that more than the rhythm disturbance, what matters is what the heart function is, whether they are
Okay.
diabetic, whether they've had previous heart attacks. And so, like for instance, if you take a patient with who has had one stent, who has got no diabetes, no hypertension, who exercises well, whose ideal body weight, his chance of sailing out of COVID is almost as good as somebody who's normal. But if you take a 65-year-old who's diabetic for 10 years, who's had a bypass or who's had three, four stents, who's already had one heart attack and the heart function is slightly reduced, he's at a higher risk,
Okay.
right? If you take people with high blood pressure, for some reason they're at a higher risk for getting sicker after COVID. Okay. So coming back to one short paragraph about recovery.
Yes.
No two bodies are alike, and the vast majority of you will all recover. Okay. Again, a very small percentage, 1% have cardiac involvement. Uh, if you look at what we have learned from global data during the last 2 years of us battling COVID, the cardiovascular related death has increased globally. Not only has the cardiovascular related death increased, all cause death has increased. And this is because of people not seeking help when they normally would when they are sick, rather than directly as an impact of COVID. So if you ask me, cardiac disease has actually gone up, but in hospital, cardiac disease has come down because people are waiting to come to doctors because they're worried about COVID. So it's extremely important, COVID or no COVID, that if you have symptoms, you should reach out to your care providers. So that is one. Second thing is immunity. Immunity is not a quick fix, like you wear a garland of garlic and you think you won't be attacked by a vampire. You can't go to the store, take your curcumin, you can't have your zinc supplement and say you're immune. Immunity is discipline, is multifactorial. Immunity is exercise. Did you know that people who work out for 30 minutes, 5 days a week, have a 30% less chance of catching the flu? Did you know that people who are more sedentary have a higher chance of getting seriously ill with COVID? Did you know that people who work out have a 50% more chance of developing antibodies than people who don't regularly work out? Do you know people who drink less have a higher chance of antibody response post COVID vaccination? So, physical fitness is an important part of immunity. Sleep is an important part of immunity. Eating well is an important part of immunity, right? Uh, Smiling, laughing, having a good mental state is an important part of immunity. So, immunity is multifactorial. You can't just do one fix and get immune overnight.